All right, perfect. It's recording. So with that being said, Danny, I'm gonna throw it over to you and let you share your screen. And then before we get started, we can do introductions and everything of that nature and get the party started.
All right, thanks Taylor, and welcome everyone. Just bear with me a second while I get my screen share going and get the slides up. All right. So you all should see a very lovely picture of a swamp right now. Does that look right? Okay, perfect. All right. Okay, so our training today is going to be focusing on how you all are measuring the success of the planning work that you are doing in your communities. Before I get into the presentation, I wanted to make sure I went over a couple of ground rules. It looks like, for the most part, you're all already sharing your video. So I want to say thank you for that. It really does help me be able to gauge if everyone is interested in understanding the presentation. So I really appreciate you keeping the videos on. We are going to have some interactive components of the training, so it's great that I can see you. Also, I believe that most of you are already muted, but just so you know, I will be asking you to speak during the presentation, and so you can just toggle the mute on and off for yourselves. That is an option that we have. So when you go to speak, just make sure that you are not on mute, and then when you are finished speaking, if you can please put yourself back on mute so we don't hear any of the background noise. And then just as Taylor said, this is going to be recorded. It's really just being recorded to share with you all and then to share with any other CPAP communities that weren't able to participate today who might want this as a resource. So I just wanted to make sure that you're all aware that that was happening and that was why. So with that, I wanted to ground us in the learning objectives before we do the introductions, because you will see that part of the introductions will be me asking you what you want your main takeaway to be. So as a reminder, when I sent out the invite for this training, I said that we would be trying to increase your understanding of how to measure the success of your planning work, that we would really be trying to share resources with each other and talk about what secondary data resources you've been using as part of your planning work, and hopefully identifying some potential new ones that you might be able to use. And then the last thing that we said that we wanted to do was review the Jordan Institute's website. So that has North Carolina's child welfare data on it. And it's a fairly confusing website, and we've had a lot of questions about what everything means and how to use it. So we want to make sure that we can increase your understanding so you all feel confident on that website and the data and what that means. So with that being said, I'm hoping to do some introductions, and I'm going to leave this slide up on the screen because I'm actually asking you all to kind of say a lot of information, but I'm hoping we can go around and have you all say your names, what agency you work for in your role, and then in addition to that, what CPAP community that you're working with, because I know that you all have roles within agencies, and then you also have roles within CPAP committees. So I'm curious to hear both from you all. And then last but not least, what's one thing that you are hoping to walk away from this training with? So with that being said, let me see here. I am just going to go around and ask people to share based on how you pop up in my screen. And Pamela, you are actually the first person that I see. So do you mind sharing first?
Sure, I'm Pamela Federline. I'm with the Partnership for Children of Cumberland County. I'm the Vice President of Planning and Evaluation. So obviously CPAP County is Cumberland. And I am the chair of the data committee that we call DART.
Okay, perfect. And what is
one thing I want to walk away with is the actual link to the Jordan Institute. I've been looking for it forever, can't find it, need it.
Link, okay, we can definitely accomplish that today.
Yeah, I'm working on a private project actually with Guilford County, and I need that data. So
Perfect. Thank you, Pamela. All right, let's see. The next person that I see on my screen is Selena.
Good afternoon. I'm Selena Rowell, and I am the Director for the Columbus County Partnership for Children's Smart Start. Our CPAP county is Columbus. We are the agency that is housing the coordinator for this work. And the one thing that I'd like to take away with is how to make sure that we get this done and done correctly and have those measurable goals.
Okay. Thank you, Selena. And I know, I'm not sure that you know everybody else on the call. So for Pamela and some of the others that are from the CPAP counties, Selena and Rosa are from our newest CPAP county. And actually, Rosa, you are next on my screen. So do you mind sharing? Oh, Rosa, I'm having trouble hearing you. I'm sorry. It seems like maybe your headset isn't working. Do you want to just type into the chat box, Rosa? Thank you. All right. I will read what Rosa says when she types it, but while we're waiting for her to do that, Monica, you are next on my screen.
Hi, I'm Monica Jacobs. I'm with the Robeson County Youth Violence Prevention Center here in Lumberton, North Carolina. I work with the Robeson County CPAP, and my role is program coordinator for the ACEs initiative.
Okay.
And I just want to walk away with some more knowledge. We definitely need more of that here.
Okay. Thank you, Monica. And then Liz, I see you next.
she might have stepped away with Ava.
Okay. All right. Thank you. Who's that? Pamela? Thank you, Pamela.
Yeah.
All right. And for some reason, Rosa, I'm not seeing your message in the chat box. Nadia and Taylor, did you see it?
I don't see it either. This is Taylor.
Should we introduce ourselves too?
Yeah, sure. PCNC staffers on the call. Can you introduce yourselves? I know that there's a lot of us present today. Nadia, do you want to go first?
Sure. Yeah. Hey guys, my name is Nadia Moretta. I am a partnership engagement manager at Prevent Child Abuse North Carolina. I do a lot of work with Pitt County, but I'll be transitioning and taking over some of Suzanne's work with Clay County. And my role is really just to represent PCNC as like the backbone organization and assist the counties that I work with technical assistance and some ideas and brainstorming. And one thing I'd like to walk away from this training with, I'd say, is to have a better understanding of data and the indicators and different things that can be added to the CPAP plans. I know Dana's going to do a great job of that, but I'll also be representing Pitt County because it looks like they don't have a representative here. So taking this back to them and hopefully adding to their knowledge.
Thanks, Nadia. Taylor, do you want to go next?
Yes, definitely. Thanks, Nad. And also, Rosa shared in the chat box, so I can read what Miss Rosa wrote. Rosa says, hello, everyone. I am Rosa Bolton, Partnership Engagement Coordinator for Columbus County Partnership for Children, and I would like to know the type of data that we should be focusing on. And Rosa, we're so happy that you're here. We definitely will be able to help you figure out the kind of data that you should be and that you want to be focusing on for your county, because data is going to look different per county. So I know we have some examples of data profiles and snapshots that we can share with you to let you see what data that other counties have pulled as well. So we're happy that you all are here. Along with Nadia, I am another partnership engagement manager at Prevent Child Abuse NC. I oversee the work being done in Onslow County, Transylvania County, and Cumberland County. So it's really been a great time working with you all. To take away, something that I would like to take away today is some resources to bring back to the CPAPs and ways that PCNC can continue to provide technical assistance and support in any way possible as the backbone organization. I did want to say a couple of things, that this will be recorded. I know that we've said that, but we really encourage you guys to please take this recording and share it with your CPAP members who aren't able to attend today. I will be sending out a follow-up email by end of day with the recording and with beneficial resources. Rosa, I know you had reached out and said that somebody was waiting to be let in to the webinar, which that is great. I was not able to, I didn't see anybody in the waiting room. So if you guys know of people who are trying to get in and who are just now registering, once they're in the waiting room, I'm able to submit them into the webinar. So thank you, that's all I have.
Thanks, Taylor. And then Lauren, would you like to introduce yourself?
Yeah, I'll just say, hey everyone, I am PCANC's new evaluation associate. I think I've overlapped with some of y'all on previous calls, but just excited to witness Danny's webinar.
Okay. All right. Thank you all for sharing. I think we have everyone because Liz shared in the chat box, and so did Felicia. So Liz, I'm just going to share what she wants to take away, which is how to better understand data utilization from the community. All right. Okay. So thank you all for taking a second to introduce yourselves. I also want to make sure you all know who I am. My name is Danny Shank, and as Taylor said at the beginning of the training, I am an evaluator for Prevent Child Abuse North Carolina, and I'm also their database manager. So a little bit about my background. I actually have my master's in public health. Prior to coming to PCNC, I worked as a program evaluator for the North Carolina Department of Public Health. And prior to that, I was actually a Peace Corps volunteer. So I did do some community organizing and collective impact type work in Guatemala. I also wanted to give a bit of a disclaimer about who I am not. I am not a child welfare researcher or child welfare data expert. So we're going to be going over the Jordan Institute webpage together, but you all might have questions that I might not know the answer to. So I just want to be really upfront about the fact that, one, we have some great collective knowledge in this training. We have Pamela, who's also an expert evaluator, and we have all of you who are really familiar with what's happening in your counties and your communities. So I'm going to encourage you all to share the resources and the knowledge that you have. And just say that if there's any questions that are asked that we don't have the answers to, I plan on following up with you all after the training. So if you identify any resources or things that you need that we don't have right away, just know that we'll plan on following back up with you. All right, so as you all were telling me your takeaways, I did write them down. I have them here in an Excel sheet. And I did that because I wasn't really sure prior to the training what was going to be the most beneficial thing for you all. But based on what you're saying, I actually think that I will start out with reviewing the Jordan Institute's website. I know that a lot of you all are new to this work. It is a fairly confusing website. Pamela needs that URL, and once we've taken some time to review that website, our plan can be to kind of take a step back and really talk together about how those of you that already have plans and are maybe further along in the process, like Pamela, are measuring success, And maybe we can share with one another how Columbus and Robeson and Bladen counties might want to start thinking about what their plan for evaluation and for tracking data might be. Does that sound good to everybody? Okay, I see some nodding. Perfect. Okay. Oh, I also see some chat box action. Okay. All right, so I'm actually gonna skip over these first two and start with the child welfare data, like I just said. So for those of you that may not even be familiar with what I am talking about when I'm referring to the Jordan Institute's Child Welfare webpage, I wanted to start off by just sharing a screenshot of the page. Just so you all know, this is what we are talking about. This is a webpage that compiles the county's submissions to the state, and it really gives some child welfare data about cases that are referred to or investigated by CPS each year and what the outcomes of those cases are. So before I dive into some of the logistics, I will say that I have made a sheet that Taylor is going to be sending after this presentation is over that includes the URL, Pamela, of the Jordan Institute's webpage. And it also includes all of the definitions that I'm going over now, plus more. I really tried to put anything that I thought I would want to know to understand the website on this page for you all. So you will get that resource after this presentation is over.
Hey, Danielle, can I just add, because people may not understand, this is a hidden URL. So you can't just search for Jordan Institute child welfare data. You actually have to know how to get to it and have a link to it. So that's why it's important to have the URL. And it was sent to me in an email, like when I first moved here. I couldn't tell you where that email is.
Yes. I absolutely agree with Pamela. Even in preparing for this presentation, a couple of times I was like, how do I get to that website again? So yeah, you will definitely receive the URL in the resource guide that I made. So you all will have that. And I believe Taylor's plan is to save it to, I don't know if you all have a Dropbox or a Google Drive with your resources as well. So it will also be located there for you after the training. So before I show you the website, there were some critical things that admittedly, not child welfare expert here, did not know. And so I thought these were going to be some key things to go over and understand before we even look at the website itself. And so some of you who might have more experience with DSS might know this. And if you have anything else to add or think that you think will be important, feel free to chime in as I'm speaking. So the first kind of critical thing to understand about the data on the website is that it is actually reporting results from two different types of assessments. So when CPS gets a report, there are two possible tracks that it gets filtered into. So if the report is a case of neglect or dependency, it gets filtered into this family assessment track. And if the report is abuse or a more severe case of neglect or dependency, it's going to be filtered into this investigative assessment track. And I'm going to talk a little bit about what those tracks mean, but just know that this webpage is going to be showing you the results of both of those different types of assessment tracks. So the first type is that family assessment. And this is a more family-centered approach. It's prevention and protection oriented. It really focuses on establishing a partnership with the family to ensure the safety of the child. So what you're seeing here is actually a screenshot of the table from the website. So when you're looking at the table, the data in these columns are possible results from the family assessment track. So if it's services needed, services provided no longer needed, services recommended, and services not recommended, that means that that is a result that's coming out of this family assessment track. So really briefly, I know this is information that I didn't know before, so I figured it would be helpful to share. And again, these are really nuanced definitions, and I've really abbreviated it for the purpose of this training, but that document that I'm sharing has the full definitions. So if you're curious in a more detailed definition, I would really refer to the document. But the services needed finding basically means that either neglect or dependency was found as part of that family assessment track, and that the agency must provide services to the family. So they're required to participate in services. The services no longer needed means that at some point during this family assessment, they did find either neglect or dependency, but they were actually able to already provide services to the family, and there's no more ongoing safety concerns. So that means, again, neglect was found, but services were provided, and then that was able to lower the risk level of the family. Services recommended basically means that neglect or dependency weren't an issue, but there might have been some other non-safety related need identified. So they'll recommend the family participates in services, but they will not require them to do so. And then services not recommended means that they didn't find neglect, dependency, or any other non-safety issue. So the family is basically completed with the assessment. They're not even recommended to attend further services. So I know that was a lot of information. And before I jump into explaining the investigative assessment track, I just want to pause and see if anyone has any questions or clarifications about those definitions or about the family assessment track. And if you could just unmute yourself and ask the question, that would be great, because it's hard for me to see the chat box. All right. So if there's no questions, I'm going to keep going. So the investigative assessment, remember that's happening if it seems like the report is a report of abuse or a severe case of neglect. They're more formal, it's a more formal informational gathering process to determine whether a juvenile is abused, neglected, or dependent. So it's not partnering with the family, it's less maybe strengths-based than that family assessment track. And it's really in response to more concerning reports of either severe neglect or abuse. So again, when you're looking at the website, the data in these columns are coming out of those investigative assessment tracks. And so you can see it's abuse and neglect, abuse, neglect, dependency, and unsubstantiated. And I will say, I'm going to pause and recognize that it is a little bit confusing that they split up the results from the two different assessment tracks across the columns. The reason why they do that is because they have the columns sorted by the most severe finding to the least severe finding. So abuse and neglect is the most severe finding, and then services not recommended would be considered the least severe finding. So that's why the data is sorted in that way in the table. So I will say that I've taken great liberties with these definitions because these are very long, they're paragraph long definitions that explain what abuse and neglect is. But just so we all have this basic understanding together before we look at the data, abuse is essentially the parent or caretaker allows or causes abuse, and that can be sexual, physical, or emotional abuse. Neglect is that the child does not receive proper care, supervision, or discipline, or the child has been abandoned. Dependency is a child who needs assistance or placement because they do not have a parent, guardian, or custodian. And unsubstantiated would just mean that there were no findings of abuse or serious neglect as part of that investigative assessment. So let me pause again and see that that's really the two different types of assessments and all of the definitions of the different findings that you will see on the website. So does anyone have any questions about that information before I go on?
Danny, I have a question.
Sure.
So when it comes to investigative assessments and family assessments, would one specific situation have both of those assessments, or just one? So like if there's a family or someone that is reported, do they get an investigative assessment and a family assessment, or just one or the other?
So it's my understanding, Nadia, that it's one or the other. So if it is, if they believe it's neglect, they would start the family assessment track, is my understanding.
So just from personal experience, it can start on an investigative track and become a family assessment once the child is removed.
Okay.
So it just depends on the circumstances, but often it starts with an investigative piece. And then once they've determined whether or not there is abuse involved versus the family needs services, then it transfers to a different social worker.
That makes sense.
So, yeah.
Thanks, Pamela. That makes sense. Any other questions? Or things to add, any of you like Pamela who know more about the CPS data than I do? Okay, perfect. Okay, so the next kind of critical thing to understand, in my opinion, about this website is that, is that you will see these two different types of tables, which I have highlighted in purple here on the screen, which is the investigative reports of abuse and neglect type of finding by decision, and then it says in parentheses, not exclusive. And then what seems like the exact same thing right below it, but in parentheses, it says exclusive, most severe finding. So I know we've had some questions related to this before, so I wanted to make sure that we covered it today. And I'm actually going to try to give you an example that illustrates the difference between the two tables. So when you're looking at this not exclusive table, basically what that means is, let's say we have a child, I will call her Sally, and Sally is going to be represented in this not exclusive table as one under the total because she's one child. But in this fiscal year, she actually had two different cases investigated. And one case had the finding of unsubstantiated, and another case had the finding of neglect. So in the not exclusive table, Sally will appear once, and then she will also appear under each of those columns. So every case related to that child is going to appear in the table. In the exclusive most severe finding, there's just going to be one case per child. So if we talk specifically about Sally, she had two findings in this year. Remember, one was unsubstantiated and one was neglect. In the exclusive most severe finding, it will just be the finding of neglect. So every child will just have one case in that table, and it's going to be the case that had the most severe finding. Does that make sense? I see some nodding. Okay. Okay. So then the last thing that I wanted to go over before I actually go to the website and show you some information there is the difference between the point in time and the longitudinal data. So I've done my best to do a screen grab here, but I'll make sure that I show you this when we actually navigate to the website. But on the left-hand side of the screen, you will see a gray box. And underneath abuse and neglect, it's going to say longitudinal data, and it will also say point in time data. From talking to Taylor and Nadia, I believe that most of you all are using point in time data. So just so you all know, when you go to that table, it's going to show all the investigative reports that happened in a state fiscal year. So from June or July 1st through June 30th in that fiscal year. However, if you go to the longitudinal data, it's a little bit different because what that is doing is it's grouping children based on the year that they have their first ever investigative report. So to give you all an example, if you're looking at fiscal year 15, there might have been, in the point in time data, 100 children. But then when you go to the longitudinal data, there's only 45 children there. because it's only showing the 45 for whom this was the first year they had an investigated case. Now, let's say in fiscal year 16, so the next year, a child in that fiscal year 15 longitudinal data has another case that happens. They will actually add that case to that fiscal year 15 longitudinal data table. I know that's a little bit confusing, but I think it will make more sense when we look at the tables on the website. But any questions about that before I go to the website? Okay.
I have a
So,
question. Sorry.
yeah.
Will the PowerPoint be shared in PDF version as a resource as well? I just want to make sure, because I've been getting a couple questions about that. So
Yes, we can definitely share the PowerPoint for you all as well.
100%. Thank you.
Okay. Sorry, it's taking my computer a minute to load this. All right. Do you all see the website now? Okay, perfect. Okay, so this is what the webpage looks like. It'll automatically open to this link. So the first thing that I want to show you is the title, because that's very important. So this link that I just clicked on has this title, which is in the blue box at the top of the page. Here in the brackets, it actually says Rowan County. So that means that currently the whole web page and all of the data on the web page is being filtered to only show me information for Rowan County. So it's really important to look at what it says in the bracket to make sure that you are looking at the data either for your county or for the state. The next important thing to look at here is what's in parentheses, which this is showing me that it's the longitudinal data. So because I know that most of you are using the point in time data, I want to show you all where to get that. So as I mentioned when I was on that slide earlier, that is in the gray box on the left-hand side of the screen. So it is right here. So you'll say that it says abuse and neglect, and then it says longitudinal, and it also says point in time. I will be clicking on point in time. So now if you look at the title, you will see that it does say point in time in parentheses. So I know that I am looking at the point in time data, which is what I said that I wanted to be looking at. So let's say I am not interested in looking at Rowan County. In order to filter the data, you go up to the top right part of the screen where it says select a region. You click on the down arrow, and then you can either select North Carolina, you could look at large counties, medium counties, or you could select a specific place. So the purpose of this presentation, I'm going to go ahead and select Clay County. And you can see here in the brackets, it now says Clay County. So I know I'm looking at Clay County's data. So I'm going to go ahead and click on this one, which is the number of children investigated by finding or decision. And it's the not exclusive. So remember, if I'm a child that had multiple cases in a year, both those will show up in this data. I'm going to go ahead and click on that. And so again, if you look at the title, it's automatically changed to let us know that we're looking at this table. That's the not exclusive data. It still says Clay County in the brackets because it's still Clay County that it's filtered for. So looking here, the first two columns that you'll see are telling you the state fiscal year. So the most recent data for Clay County here is from state fiscal year 2019. Looking at this, there were 100 children who had investigated cases that year. And also looking at this, it looks like most of their cases were actually that family assessment track. So remember, the investigated cases are going to have these results and the unsubstantiated. So there were 7 investigated track cases, and they were all unsubstantiated. And there were mostly family assessments conducted. So looking at this, they had 24 that met the definition of services needed, which would have indicated that they found neglect and that the family is going to be required to participate in services. And they also had 2 in the services provided no longer needed. So when you're thinking about, like, I know a lot of times you guys are interested in looking at substantiated versus unsubstantiated. You could add these together because these are both findings of neglect. It's just that this finding of neglect, the family still needs to go to services, and those 2, they already received services. And then there were 30 that were services recommended. So remember, those are going to be cases where neglect wasn't found, but some other non-safety issue was identified. And then there's 40 services not recommended. So that would basically be like unsubstantiated. There wasn't neglect found, and there wasn't another safety issue found. So let me pause again and see if anyone has any questions about anything that I just went over. Okay, so I'm actually going to go ahead and open the longitudinal data in a new tab. And again, we're still on Clay County because I haven't changed the filter. So I'm going to go to that same table. And if we look at our total here, it's 45. So what that tells us is that out of these 100 children that had investigated cases, 45, this was the first time they ever had an investigated case. So they're showing up in this group of cases. And as more fiscal years happen, there might be other findings added to this table because the child is always going to be tied to the fiscal year of their first report in the longitudinal data. So I'm going to go back to the point in time, and I'm going to actually pause the presentation and pause my screen sharing and ask you all if you have any other questions or want to review anything else on the website. Okay. So I see Liz shaking her head. Everybody else, do you feel like you understood the website? Okay. So like I said, there's some other tables there, but the info sheet that Taylor is going to share after the webinar will give even more definitions and talk a little bit more about the other tables that are on the web page. So looking at time, we have 17 minutes left. I'm pulling back up what we all hoped our takeaways would be. And I know that we have a little bit of a unique thing happening here in that we have Monica and Rosa and also Selena, who are from our newest planning counties. And so they're in maybe a different spot than Liz and Pamela are in terms of where they're at in their planning process. And I know you mentioned kind of wanting to get a handle on what data you might want to collect and how you can set yourself up for success. So I'm curious if our other counties can talk a little bit about what data you all are tracking, or if you were to go back in time and tell your old selves what would be important to think about, what would any like pieces of advice you might have for Monica, Rosa, and Selena? I see Liz, you're here. Can I voluntold you to share? Oh, and Pamela's back too. Okay, awesome.
Well, I would ask Pamela to go first. I'm newer with the partnership. I've only been with the partnership for 9 months. So I can say what data that I enjoy looking at and what I found to be most helpful. But Pamela has she's our VP of all data at our organization.
Okay.
I'll let her go first and then I'll add on anything.
Okay, perfect. Thank you.
So let me just say a couple things. One, you know, what we're tracking right now is specifically tied to the what I call the outputs associated with what we put in place as far as the things that we wanted to accomplish. And that has to do with the signatures on the things that we put out in the community saying, do you agree with what we're doing with this plan? So we have this process of getting signatures. We've done a very good job of doing that. The resilience film, we have how many times that film has been viewed and by how many people, and then various trainings that have been going on, Connections Matter, Protective Factors, other types of trainings. We have the data on how many people have been trained. However, what we have not done, which is why I wanted the Jordan Institute site, is to be able to do some longitudinal look at where are we with data right now. So in pulling up, if I'm pulling up Cumberland's data, I want to be able to tear into that data, looking at what is this is what I'm doing for Guilford County right now with their court collaborative. I'm looking at the back end of their data. We did a record poll of 100. We're actually using 94 of them. And I did a disproportionality index to put it through a racial index, a racial equity index. So I'm looking at how many children of color are in that caseload that we pulled. And when you consider the total number of children in custody at the time that they did the poll, which was March, April, and I did not do the record poll. I am just the data person here. They had about 500 children in custody, and we did a record poll of almost 100 kids. So we took 20% sample. That's unheard of, to get access to a sample that big and be able to look at the back end. So this morning, for example, I was looking at judges and which specific judges had which cases and how many adoptions versus reunifications, because that's their big problem up there. They are an adoption focused county, particularly with children of color. And so those are some of the things that I would like to see translated to here. Now that I know how to do it up there, I would like to be able to ask for DSS to let us do a similar record pool here so that I can do the same thing with the data. So it's very interesting to get a look at the back end, if you will, of these kinds of experiences. The time and care alone in the narrative that I just wrote, I just want you to put this in perspective. The 94 children who are being assessed have time and care ranges from 4 months or 2 months to 87 months time in care. 87 months time in care. I want you to think about what you did for 87 months and why that number is important. So then I took all of the time in care and added it together, and it came out to, for 94 children, 195 years of time in foster care. Those are real kids, not just numbers. So the more we can take that information and translate it for the community so they understand what this means. Because for some kids, they're in good families and it's not lost years, but for many of them, it's lost years. And so that's what I'm doing, is that. And I want to be able to bring that to Cumberland as well. So I know that once the project is finished, the Superior Court judge for the state of North Carolina will be looking at this report, and there's a potential that this is going to happen all over. I don't know that I would be involved in that, but the setup for how I've done this will help other counties.
Thank you for sharing, Pamela. That's really
Sure.
interesting. It's exciting data that you're getting access to. So I will pull out a couple of key things that I heard there for Rosa and Monica, and Selena had to jump off to consider. So it sounds like one of the things that Cumberland County has done is they've had a system for tracking their outputs related to the plan. So Pamela mentioned tracking the resilience screenings, tracking the Connections Matter trainings that they're doing related to the plan. And then I will also say the other key thing that I heard there is that to some extent, the information that you all will want to track is dependent on the goals that you are identifying in your plans and the needs that you identify in your communities. So Pamela is talking about the specific project that she's doing, and that might be relevant for your counties, Rosa and Monica, but it also might not be something that you focus on depending on what the results of your environmental scan are and what you all select as your goals. So really, there's going to be some data that we're all looking at, like the child welfare data related to the website that we just reviewed. But you'll also want to think about collecting some more short-term outcomes. And all of that's going to be dependent on the activities and the goals that you select as part of your plan. Does that make sense?
Danielle, can I just share my screen for a second? Liz is very familiar with this screen because we just shared it. And I don't know if you can see, you have to stop sharing, I guess.
It looks like it's working.
Okay, so this is the Wilder inventory, which is actually an assessment of how well your community collaborative is working. And we use this tool, NCPC, it's one of the, for the Partnership for Children, this is one of the outcome measures that we use. So we're able to use this with SOAR as well, which is our community collaborative. And so we have, as you can see here, I've got 3 years worth of data. And I created a trend line so you can see whether things are stable, going down, going up. The things that are in red are problem areas. And so what this tells us is around these specific issues with our collaborative, where are some areas that we need to put some focused energy with the group to make sure that we are moving in the right direction. So this is helping Liz and Faith as they repurpose or moving forward. This is part of the information that helps them with that. So anyway, so we do this once a year, and I just compare it to the previous year each year.
Mm-hmm. And so can you share, like, I know maybe it would be helpful if you could share some examples of
Sure.
Liz or Pamela of what you do with that information or how you found it to be helpful in the past.
So a couple of things that I find useful in this data is looking at the areas that we need to improve is looking at it. For me, I look at it from the perspective of a SWOT analysis. So looking is what are opportunities and our threats. That's kind of how I see those, and I like to categorize it as such. And I like to, because obviously we want to keep those consistent. SOAR is under a, kind of like Pamela said, a repurpose. So we want to see what's been working, what's effective, and what are challenges that we have. So for example, we talked about funding on our last call. That's not really, we don't rank well with that, but it's also not a priority necessarily for us because it's part of our mission, our two organizations that are kind of our host organizations, if you will, for this. So, you know, you have to really, like, you can't just look at a data point and say, huh, that's bad. Like, what does it actually mean? What's the story that it's telling? So that's how I find it to be useful personally.
Thank you, Liz. All right. So I will say, just to give those of you who are not as familiar with this tool a little bit more background information, it's a really good way to kind of do a temperature check of your committee and how things are going. Are you all on the same page? Does everyone feel like it's collaborative? And really just see, like, how are you functioning internally together? Because obviously, if those things aren't happening, if we're not all on the same page, if we don't have trust in one another, it's going to be harder for us to achieve those outcomes that we are trying to achieve as part of the plan. So we do really highly recommend you all thinking about using this in your counties. And it looks like Taylor will be sending that tool to you as well. So actually, Pamela, do you mind stopping your share? Because I'm going to do a wrap-up activity really quickly. Thank you. All right. So I know we went over quite a lot of information today. And I want to just, here, let me minimize this for you all. Really quickly with you all, if you could, in the chat box, just reflect on one thing that you learned and you're taking away from this training, and just go ahead and once you've thought on what it is, put it in the chat box for us. So it looks like Nadia is saying she learned how to interpret the Jordan Institute webpage. So that's great.
I'm driving.
All right. Okay, Liz says that she learned the differences in what counts as different data points, the Jordan Institute capabilities, and better understanding the terms used to break down the information. Monica said how to access the data and interpret the different types of data. Taylor said what our CPAPs are interested in learning more about. Pamela, the web link. And the difference between the data terms. Rosa learned about the investigation, versus the family assessments. That was new for me too, Rosa, when I reviewed the website. And Lauren learned the difference between the different types of assessments as well. Okay. Sorry. Okay, so this is kind of similar, and we're almost out of time, so I'm going to actually skip what you have squared away and actually ask you to think about what's still circling in your minds. What outstanding questions do you have? What do you want more information about? So any other things that you think you need in order to take what we talked about today and be able to implement it in your communities. If you have other questions, just type them in and we'll make sure that we're answering those when we follow up. Okay, so Nadia still has circling specific indicators. Taylor saying you can also reach out to your CPAP people if you have other questions. Okay. Okay. So it looks like no one else has any other questions, but like Taylor said in the chat box, if you all think of anything after this training and you have another question and you want more information, feel free to reach out to either Taylor, Nadia, or Felicia. And if they need my help responding, they will reach out to me accordingly so we can get you the answers to your questions. So that is all I have for you all. However, I'm going to be asking you to take this evaluation of this training. So I'm actually going to go ahead and stop my share and then share the link to our evaluation. Or yes, I see that some of you are taking a picture, so I'll pause briefly. You can also use your phone to scan this QR code and the survey will come up on your cell phone. So I'll give 1 second for those of you who are doing it that way. And then I'm going to stop sharing and share the survey link in the chat box. Okay, I'm gonna stop my share.
Won't do it from the computer screen.
It's unfortunate. It's very challenging to get it to work. Give me 1 second.
Yeah, there's another thing you need to know about it too, and that is that it will not work from a copy from a copy. So like if you do a survey and you give a QR code out on a piece of paper and then you say, oh, I need a copy of that, and you go make a copy of it, it slightly skews the original. So what we do is when we do surveys, we actually do a little slip of paper and it has a QR code on it. We can hand those out and people can do that wherever we put them on posters. But if you make a copy from a copy, the QR code becomes unusable.
So the trials and tribulations of evaluation, everyone.
Right.
All right, so I just sent the survey link in the chat, and I will also ask Nadia and Taylor to send it out in the follow-up email with the resources. So you can expect to receive an email from us in a little bit that has the recording, the survey link, and then also the document that I've been referring to with the URL and all of the definitions. So with that, I will say thank you all for participating today. I really appreciate you all taking time to share with us, introducing yourself, and also Pamela and Liz, who's no longer on the call. Thank you for sharing from your experience. Cumberland is the county that has been doing this work for the longest. I really appreciate it.
Thank you so much.
Yes, thanks, Rosa. Yes, everyone doesn't know, I actually know Rosa from the work with the prevention programs team. Yeah.
Yes.
I met Rosa, I think I met you maybe in my first week ever of working with Prevent Child Abuse North Carolina.
Yes.
It was a while ago now.
Yes.
It's good to see you again.
Good to see you also.
And thank you, everyone else. Have a good rest of your day.
Thanks.
Bye-bye.
Thank you so much.
Bye.
You also. Bye.
Thanks for being here.